Yeah, the roads are very curvy and windy, and it's difficult to drive with a compact car, much less a Winnebago.
On a sunny Tuesday morning, Teresa Gardner and Paula Hill Mead are steering their 30-foot RV through the hills of Appalachia. But they aren't on a cross-country vacation. They aren't even that far from home.
This is one of our longer drives that we're taking today.
Teresa and Paula are nurse practitioners, and they're driving to offer health care to patients who might otherwise never reach a doctor's office. The familiar problems of health care in America are magnified in Southwest Virginia by poverty and isolation. And when we pull into Grundy, Virginia, there's already a line of anxious patients, people like Bonnie Hurley, who says she's found herself with nowhere else to go.
It came down to either you eat or you pay doctor bills.
We've got such limited space. And Bonnie, your medication's in. How are you doing, honey?
If they saw these people that were crying, a 5-year-old because he couldn't get his teeth fixed, and he said, go ahead and pull them even if I cry. If they saw how desperate the need was, they would know. People that think there is not a problem with health care in this United States are very naive, very naive.
2 years after passage of the Affordable Care Act, millions of Americans still can't afford care. And while the country waits to see if and how the plan will be implemented, for now, the Health Wagon is part of the solution for nearly 4,000 patients a year, between its mobile stops and a small clinic.
Is that the pain from my legs?
Grateful for the free care, patients help out however they can. Mark Mullins has shoveled the clinic driveway. Bonnie Hurley brought pumpkin rolls to her appointment.
The gift I have made you.
This woman spent 3 days crocheting doilies before her visit. It may be a charming way to run a health clinic, but it's based on something hard to replicate, a series of lucky twists and selfless decisions that started with one woman moving here 30 years ago.
Sister Bernie Kinney is just a phenomenal woman. She was a Massachusetts Catholic nun who relocated to Virginia at the request of the Richmond Catholic Diocese. She actually started out in the back of a Volkswagen Beetle because she's seen a need and she responded to meet that need. Across the nation now you see that mobile clinics are starting to catch on, that the other communities are seeing that. But she was truly ahead of her time 30 years ago.
In 2005, with Sister Bernie facing retirement, the Catholic hospital supporting the mobile clinic was privatized, leaving the Health Wagon to find its own funding. So now Teresa and Paula spend their days providing care and nights looking for donations.
I'm sure there are other jobs you could both have that would pay more money, be shorter hours.
We had this discussion last night, actually.
So
It was one of those nights that you go home and you go, wow,
I think about every night like that.
So what are you doing here?
Growing up, we were raised in a very religious family. We were taught that the way you find yourself is to give yourself to others.
But we've reached the point where in order for this segment of the population to get care, people need to make this almost charitable sacrifice.
Yeah, it is a sacrifice. Most definitely that we've made. But there's not a day that goes by that somebody does not walk through that door that they ultimately, if we had not been there, would have ended up in the ER, or in a lot of cases, dead from the diseases that we see.
Now, how often are you taking your medicine?
Many people would be shy to discuss their medical problems or to talk about their inability to pay for treatment. But virtually every patient we met at the Health Wagon wanted to share their story. And just about every story we heard had the elements of modern tragedy.
I'm 52 years old, damaged merchandise, and you just can't find a job.
Mark Mullins lost his health insurance along with his job and is left with few options. Years ago, he became too injured to do heavy labor and became a truck driver. Then he developed type 2 diabetes, disqualifying him from most trucking jobs. Unable to find work, he scrapes by with a disability payment of $1,150 a month.
I can take that $1,150 a month and make a $725 house payment, $250 electric bill, which is outrageous, I think, sometimes too. And you see where I'm going with this? I'm almost out of money.
Yeah.
By the time I buy a couple tanks full of gas, it's gone.
The Affordable Care Act was designed to help people exactly like Mullins.
Everybody should have some basic security when it comes to their health care.
And focusing on ensuring the poor rather than containing costs was part of what made Obamacare so unpopular. So we thought it was interesting, one of the very people who stands to benefit the most opposes the plan insisting cost control should have been the focus rather than a top-down mandate.
It's a wonderful thought, but they're going about it the wrong way. If they tried to force me to buy insurance, they just have to put me in jail because I couldn't pay it. There's a big portion of this country couldn't pay it.
Yeah. And you don't think you'll qualify for free insurance?
I don't think they'll offer us free insurance, to be honest with you. Somebody's got to pay for it.
But even if Mullins ultimately gets Medicaid coverage from Obamacare, and if the law is upheld, he should be eligible in 2014, that still won't solve the healthcare crisis in Southwest Virginia. The problem here isn't just about insurance. What Sister Bernie realized when she got to Appalachia, the reason she fixed up that old Beetle and drove from town to town, was that it isn't just cost preventing people from getting care, but basic access. In large chunks of rural America, there simply aren't that many doctors. What's surprising about the Health Wagon's patients is how many of them actually do have insurance.
Now, in and out.
Buford Smith is a retired lawyer who's covered by Medicare, but still relies on the Health Wagon.
Usually with the doctors, I would go to Bristol. That's a long drive.
How far is that drive?
Probably 75, 80 miles, something like that.
80 miles to the doctor.
Not every medical procedure requires a doctor, so healthcare experts say part of the solution is nurse practitioners like Teresa and Paula. But sometimes physicians are needed, so the Health Wagon has turned to telemedicine.
Tell them what's been wrong with you today.
The system links patients here to doctors at the University of Virginia, saving a 500-mile round-trip drive.
We actually do more than anybody in Southwest Virginia using telemedicine, maybe because we're the most desperate.
But the lack of rural doctors is hardly specific to this one community. Our drive through Appalachia to meet Teresa and Paula was a tour of one of the many stretches of America with few healthcare options.
We drove through rural communities in West Virginia, in Kentucky, and then here in Virginia. And I couldn't help but think of all the communities we're driving through that you guys can't get to.
Oh yes, there's such a need, and we have those phone calls all the time. Requests to come to their community, but we're a small organization. But if we had the financial support and the backing, we could be able to branch out into more community, because there's a need all across this nation for services that we provide.
Nationally, there's a maldistribution of physicians.
Dr. Walter Frank is also on the front lines of the shortage and is part of a very different, very new solution. He's practiced medicine in rural upstate New York for 39 years and says not only are there not enough doctors in rural America, there's a second related problem, a shortage of family doctors, the type of doctors who tend to serve rural communities. And that shortage may only get worse, since fewer and fewer students are pursuing careers in primary care.
Certainly it's true that the interest of medical students nationally going into the primary care fields, particularly my own field of internal medicine, has waned.
Frank works at the Bassett Medical Center in Cooperstown, New York, a little village of just 1,800 people, best known for the Baseball Hall of Fame. But the medical center serves a considerable portion of upstate New York, drawing some 400,000 patients a year. That's more visits than the Hall of Fame gets. And recruiting doctors has long been a challenge. One solution has been inviting residents and medical students to train here, and in the meantime, show them the charms of Cooperstown.
Residents who came to Bassett and spent several years here would often stay. Students who would come here for briefer periods of program, for rotations, came, had a good experience, but did not.
And did you have a feeling that they weren't spending enough time here to kind of plant roots and decide to stay?
Yes, quite clearly.
So 2 years ago, Frank left his position as chief of medicine at Bassett to help start a more ambitious recruiting tool. Instead of inviting medical students to Cooperstown for a month, they would have them spend 2.5 years here as part of a joint program with Columbia University. After a year and a half in New York City, the first class moved to Cooperstown in January. They were selected for their academic pedigree, yes, but also because it seemed they would fit in here.
I grew up in western South Dakota near Mount Rushmore, and I show people pictures from back home, and everyone comments about how it looks a lot like Cooperstown. So it's definitely a good fit for me.
Blake Alberts was the ideal candidate for the Columbia Bassett program, comfortable in a small town setting, and personally familiar with the challenges facing rural health care.
My father had prostate cancer, and needed to have a prostatectomy to remove his prostate. He ended up having to travel from our home in Rapid City, South Dakota to Minnesota to have his surgery done.
To Minnesota?
Yeah, which is 600 miles away, because we had one urologist in all of western South Dakota, which is, an area 10 times the size of New Jersey.
But if the Columbia-Bassett program is meant to help those dual shortages of rural doctors and primary care doctors, Blake checks just one of the boxes. He wants to return home to South Dakota, but not necessarily to start a small primary care practice.
I don't know what type of practice I'll end up working in. My parents, they grew up in South Dakota on the farm in a small town, like I said, but then they're small business owners now. And so I sort of grew up always with that mentality.
Is a doctor's office a good business to start?
Right now, it would seem no. I mean, I think people our age just aren't as interested in that. They're more interested in, working for a healthcare system where they can really just focus on the medicine side of things and not have to worry about the bills and the administration.
And beyond the paperwork, there's the matter of pay. Primary care doctors simply don't make as much money as specialists.
For students who are in medical school and foresee that their debt is going to be $150,000, $200,000, as is not uncommon, their choice as to what they might select as a career can't help but be influenced.
It doesn't make sense to do primary care.
It doesn't make economic sense to do primary care.
To make it easier to choose a less lucrative career, the Columbia-Bassett program reduces that medical school debt with a $30,000 a year scholarship. It comes with no strings attached. They don't have to practice in a rural community or choose primary care. Frank says those are choices the students have to come to themselves, and the 10 members of the first class are not there yet.
How many of you think you'll end up in a smaller community like this one? How many of you think you'll end up in primary care? Maybe none.
The students are quick to point out they're less than halfway through med school and are still weighing their options. And the reason most of them came here was less about the rural setting than two other features of the program: the chance to follow their own patients for the next year, and the opportunity to take special business and public health classes exploring the root causes of healthcare inefficiency.
Because ultimately, I think most people will agree that the shortage of primary care practitioners isn't just an issue of making people just want to go out and be primary care practitioners. The system is currently set up against that.
So what would it take for you to make that choice rather than the other choice? Because that's really what we need to do, right? We need to incentivize enough of the 10 of you and then the thousands of other medical students all over the country so that we don't have that shortage. What would it take for you to make that choice?
At least for me, where I end up is going to be completely dependent on what area of medicine or where my interests in medicine lie. I guess I'm not a good enough person to say I will choose something that I don't love for the greater good. I'm not a good enough person to say that.
And I mean, let's be honest, like if we go to school for 8 years, like you want to be able to practice and carry out everything you've been trained to do. And it seems like you see so many patients coming in and they demand that you give them a referral, and it seems like you just end up playing facilitator for so many people and sort of navigating their course through the healthcare system. And I don't think that's why most of us got into medicine.
Part of the challenge primary care faces is that the process of rotating students through different areas of medicine leads most of them to conclude the other specialties are just a bit flashier. We met Monica Laskowska on her third day of a surgery rotation.
Personally, I don't know what I want to go into yet, but everything's been really interesting, especially surgery. I mean, scrubbing in and actually getting to see some procedures. It's exciting.
And just as primary care struggles to compete with the glamour of a specialty, small towns have trouble competing with the glitz of the city.
One difficulty that they have in South Dakota is that all of their physicians, for the most part, were trained outside of South Dakota and mostly in more urban areas. And during their time, even if they grew up in South Dakota, during their time outside of the state, they came to appreciate some of the cultural and artistic opportunities that a big city offers. Physicians, for the most part, are highly educated people who are, interested in these type of activities that aren't necessarily available in rural areas.
I keep hearing people looking for polite ways to say doctors don't want to live in these places.
Yeah, they don't want to live in a podunk place, exactly, yeah.
We asked the students yesterday to raise their hand about what their plans were. Did any of their responses surprise you?
No, no, and I think I think it'd be interesting to see if you came back in a year at the end of their longitudinal program, how they would respond to the same question.
What do you hope the change will be?
I'd like them to make. I would like some of them, yes, to. I guess I'm happiest when they say they are picking a career in primary care because, you know, that's what I did. But I think that's what we need.
Ultimately, it has to be their choice.
It has to be their choice.
We are trying to help them make that choice.
We are.
You can still smell the pavement.
You
it's
can.
Like
Freshly striped.
In Wise, Virginia, Teresa Gardner and Paula Hill Mead have made their choice and are preparing to open a new clinic 5 times the size of their current home, despite a reduction in funding from the Commonwealth of Virginia.
Starting here, we've got 6 exam rooms. As I said, we're still needing exam tables and some equipment. They're a little bit bare right now, but we know
Is
that.
the equipment on the way, or you're still waiting?
No, that'll be. We've got to raise funding or get someone to donate that.
But even if the equipment and the volunteer specialists come,
This is going to be our vision room.
even if it all runs as planned, it will be a 5,000 square foot healthcare clinic without a single full-time doctor.
It just seems to get worse and worse. We see more and more patients, more and more are turned away.
Nobody here at this office would be able to see you today.
And if the Affordable Care Act works out, we still don't have here in far southwest Virginia and the mountains of Appalachia enough health care providers. I mean, that's great. Everybody's got insurance now. I mean, who are they going to go to?